And
That's great.
welcome, all of you. Okay, let me start this PowerPoint that'll help kind of go through what we'll talk about. But again, any questions that you have, very welcome to hear that. Hold on. Let's share this. Okay. Can you all see the first slide, the introduction to our meeting today? Okay.
It looks good here.
Yeah.
Perfect. So welcome to this FY22 application Q&A session. It's for specifically the e-cigarette, marijuana, and other drug prevention grant program. Second year running, and hopefully the first of many years. I'm happy to answer any questions that you have. We'll have time at the end, and if you have questions throughout, please feel free to speak up. It's pretty informal, but remember this is recorded and will be on the website and available to anyone else interested in seeing what this grant is about. So overall, and you both that are here today are familiar with this, but just as a general statement, this came out of the 2020 legislative session, specifically Senate Bill 37, wrote it into code where we could take e-cigarette tax funding collected and then apply it to these community grants. So it's really neat. It's a neat opportunity to try to address specifically e-cigarette addiction in our communities. And, hopefully our efforts are effective and we'll just get less and less money over time. It's an annual funding opportunity at this point. And for Utah County, we try to keep the grants from $50,000 to $100,000 per award per year. So the 100,000 cap is set in Utah code, but the 50,000 is something that we decided with Utah County. If you have a really strong application, that's $49,000. So please still submit it because it's possible we could still be able to fund that. But we're aiming for at least 50,000 to 100,000 per award so that there's a significant amount of money going to each grantee. I think this COVID-19 disclaimer is still relevant. We want you to consider, as you're putting together your ideas, what would be really realistic to do in this current climate. Thank goodness for things getting a little more back to normal, but as we're still in the pandemic, keep that in mind as well. So overall timeline for how this is rolling out, we announced the FY22 grants pretty much June 9th. Around that time, we have our Q&A session today. The application is due for everyone June 30th at 11:59 p.m. We will turn it around and let everyone know whether they receive funding or not by July 15th, and hope to get those contracts and agreements in place so that you can get going and up and running. Technically, the project period is from July 1st to June 30th, but it'll kind of depend on when we get those contracts signed. And then there will be quarterly progress reports due. So each quarter, the month following is what's listed here. The 15th day of the month following is when a progress report would be due. And then a final report that will get funneled up through back to the legislature will be due sometime in July or August of next year. So that's the general timeline. So it's important to be aware of what makes you eligible for the grant. So you must fit into one of these categories. You either have to be a coalition of community organizations that focuses on substance abuse prevention. You need to be a local government agency, such as law enforcement agency, for a program that is focused on substance abuse prevention, or a local education agency, or a blend of the three. So that's what makes you eligible for the grant funding. And this is laid out in Utah code. So it's something that we're pretty careful about in our awards. And then overall, you guys might have started looking through the application. There are 6 components to the application that you need to make sure you're checking off as you go through. You need to make sure you finish the application cover page. You need to have a community description defining, the community that you plan to serve. You need to have a good statement of the problem. You need to have a clear description of your selected interventions or your proposed solutions. You need to submit an action plan, and as part of the action plan is a space for you to put in your evaluation plan as well. And then you need to submit the budget form, which is also the budget justification, are both included in the budget form. So those are the components of the application. And we'll take the next little bit and talk about each of these components and what we're looking for. So the grant project focus overall, we want to remember that this grant is trying to address root causes and factors associated with the use of e-cigarettes, marijuana, and other drugs. And to get at those root factors, we want you to be very clear about how you're addressing risk and protective factors as identified in the Utah Sharp survey. Again, you both are probably very familiar with this, but if there's anyone who watches this later who's unfamiliar, this is a survey that's collected every other year for 6th, 8th, 10th, and 12th graders, and it helps to get at, substance behaviors and substance use among these age groups, as well as the risk factors and protective factors that feed into the substance misuse, and a bunch of other stuff. It's a really interesting survey, and they'll break that down by county, and they also break it down by target audience. We'll talk about that a little more later too. Also, you want to make sure, so you're addressing the risk and protective factors you're going to be targeting with your interventions, and you also want to show how your interventions align with the 7 strategies as outlined by CADCA, which again we'll talk about a little more later. And all activities must be evidence-based or promising practices. And we're really looking for grantees that are trying to solve a new, not a newly identified, but an identified issue that they haven't already been doing projects around. So if you already have funding to do an activity, we are, if you want to expand it or increase your reach in that way, that would be appropriate, but we don't want to fund things that you're already getting funding to do. Yeah, if that makes sense. So this goes in a little more detail about the Sharp survey. There's a link to where you can access them if you're not familiar. I took a screenshot of all the different reports available. So the most recent is still 2019, but we might be getting 2021, probably, I don't know when that's coming out. That will be very interesting to see, especially with the last year that we've all gone through. But as you look on that website, you'll see a list of all the different reports. We want you to look specifically at Utah County. Also in the red square, you can see other ethnic groups that you might want to focus in on, disparate groups, and the reports that specifically relate to them. And if you want to drill down even narrower, you can work with your school districts. They can sometimes help to get you a little more specific data for your community. Also, our prevention program can help get reports that for Utah County, we'll kind of group it. So we've got North County, Central, which is Provo, Vineyard, and Orem, and South County reports. Hispanic Utah County report, and an LGBTQ plus Utah County report. So those are resources too. If you're interested, reach out to me or reach out directly to our prevention team. I can help to coordinate that though as well, to help you get data more specific to your areas that you're trying to serve. Any questions to this point? I mean, I'm assuming Shirley and Tamara, you guys know what's up, but this all sounds
great.
Sounds
Yeah.
familiar.
Yep. Yeah, I'm good. This is great.
Okay. So diving a little bit more into our Sharp reports and the materials in there, I like to just share this. Maybe this is a little bit of a tangent, but I like that with this graph, this is available in the Sharp survey report. And I like how they list out all of the risk factors that they've identified with adolescents and how they compare to 6 of the problem behaviors. And if we were to try to address any of these risk factors, you can see how it would also impact these other health issues. So I like to look, extreme economic deprivation under community. If we were to address that, that would hit 5 of the 6 health behaviors and probably reduce or mitigate those behaviors. I just think it's cool. This isn't maybe as relevant to your application, but I think it's important we all keep in mind, as we go upstream, we're able to impact so much more than just our narrow focuses. So you can look at substance abuse here and also use this to get a feel of, well, it looks like availability of drugs is important for substance abuse. These laws favorable to it, media portrayals, etc. Pretty much all of these risk factors will influence substance abuse among our target populations. But diving a little further, so in each of the reports, it will lay out the behaviors for you. So you can take time to look through and see what kind of substance misuse issues are happening in our county that maybe you want to focus on. It shows it by year. So the orange was 2015, yellow is 2017, and blue is 2019. And then you can see how it compares to the state average, which is the dot, and then the Bach Harrison norm, which is the triangle. So it kind of shows how we're comparing to the state and other factors. And they'll also break it down by grade. So you can see for 6th graders over the years, what's been going on, 8th graders, 10th and 12th. I just pulled, this is for all grades. So this is a summary of all grades, but you can drill down even deeper, which is kind of fun. But these are this is the risk profile for all grades from the 2019 SHARP data. So you can kind of see over the last 6 years, how the rates of these different risk factors have increased or decreased, how they compare to the state. I mean, I think the one that stands out to me is the low commitment to school seems to be pretty high and also seems to have increased over time. Again, you might find more detail as you drill down into the grades, but this is a great chart to look at just to get kind of familiar with more of the risk profile and how it's coming out in Utah County. I think you want to look for rates that are increasing, so you can see trend data increasing when you look at the orange to yellow to blue. You can look at things that are risk factors that are just higher than anyone else, and you can also consider ones that are higher than the state average to kind of figure out where maybe you want to focus. Does any of this? Well,
No, but I'm sitting here fascinated. I don't think I've ever looked at the Utah County one.
oh yeah, yeah.
That in Utah, because we're below the national average on every single thing except attitudes favorable to antisocial behavior. I'm just sitting over here being a fascinated data nerd. That's all.
Yes, I mean, be a data nerd. Yes. Well, and if you start to look, because I was just reviewing this earlier, and as you start to look into the grades, you see even more differentiation. This is an average, so it kind of washes it out just a little bit, but yeah, definitely things to look at. Okay, and then this is, again, just all grades for protective profile or the protective factors. So you want to see which ones are maybe decreasing or lower than the state or national or the state average or than the other protective factors to get an idea of where you might want to focus for your community. Again, this is Utah County and then all grades, but you can drill down by grade. You can drill down even further if you want to look at North Central or South County data, Hispanic or LGBTQ plus community data. But yeah, for me here, I mean, this one kind of looks like it's going down, the pro-social involvement. And you want that to be going up. The higher these are, the better. And so
Yeah,
that could
that
be
was
way.
before 2020. So I can only imagine what the new data that comes out.
Yeah, I think getting the 2021 data will be really, really interesting for us, damage control wise. Okay, so going through the reports, there's a lot more detail in that SHARP data report. It's like 100 pages long. So if you ever want to talk about it further, though, please feel free to reach out and we can talk, or I can connect you to people who are much more familiar with the SHARP data. But you want to make sure that your proposal and your problem statement includes these factors, the risk and protective factors that you have identified as really critical to your community and the behaviors and rates that are critical. And I didn't include screenshots of them, but they have really good reports of vaping use rates, alcohol use rates, marijuana, all sorts of behaviors and perceptions in that SHARP data. Okay, so CADCA 7 strategies. This is also laid out pretty specifically in Utah code. They want you to identify from the CADCA 7 strategies interventions that you'll use to address your problems that you've identified. So these are the 7 strategies. They're kind of grouped into 2 groups. So provide information, enhance skills, and provide support are grouped together. And then enhance access to reduce barriers, incentives, disincentives, change physical design, and modify and change policy are kind of grouped together. And we'll go through each of these. So the first 3 are grouped together. They are more about educating the public, raising awareness, helping individuals make healthy choices. They tend to affect smaller numbers of individuals and don't tend to impact the community at large, but they're often necessary where your community might have denial or limited knowledge about the current problem, if that's a common situation. And they're great at providing initial information necessary to bring the community together around an issue And they're great when partnered with the other set of strategies. So provide information. Those are your educational presentations, your workshops or seminars, and data or media presentations. And then I've provided some examples here that I pulled from the CADCA website. So public service announcements, brochures, billboard campaigns, town halls, that kind of thing. Enhanced skills strategy is your workshops, seminars, or activities designed to increase the skills of participants, members, and staff. So examples would be trainings, technical assistance, parenting classes, strategic planning retreats, that kind of thing. And then the provide support strategy is opportunities to support people for participation in activities that reduce risk or enhance protection. So referrals to services, support groups, youth clubs, parenting groups would all fit under the provide support strategy. Then the other four are kind of grouped together, and these are more environmental, they're community change focused, and a good plan would include a variety of, these partnered with the three that we previously talked about. So your enhanced access or reduce barriers is about improving systems and processes to increase the easeability and the opportunity to utilize systems and services. So making the healthy choice the easier choice and reducing barriers to those choices. And then examples are access to treatment, childcare, transportation, housing, breaking down barriers with culture and language, etc. And then strategy about incentives and disincentives. So increase or decrease the probability of a specific behavior that reduces risk or enhances protection by altering the consequences for performing the behavior. So increasing public recognition for deserved behaviors, or taxes, citations, that kind of activity. Change physical design is literally changing the structure or design or environment to reduce risk or enhance protection. So signage increasing signage, landscaping, that kind of activity. And then the last one, modify and change policy. So actually changing procedures, bylaws, rules, city ordinances, state law. And examples of that are working in your workplaces to increase, to change policy in your workplace, law enforcement procedures and practices, public policy actions, those kind of activities. So those are the 7 strategies very briefly talked about. I know you guys know about this. I feel like I've learned more and more about ideas for each of these as I've gotten to work with the grantees. So it's been really fun for me. Yeah, we want to make sure as you're developing your proposed interventions that you're able to detail how they're evidence-based and also show how they align with the 7 CADCA strategies. That'll be important. And there's lots of different options for looking into evidence-based. These are just some examples for where to look to find ideas for where you could pull evidence-based or promising practice activities. And there's more listed on our webpage about the grant opportunity, so feel free to go there as well. Or if you find another resource that's really good that I don't have listed, let me know. I'll add it to it so everyone can have access to good resources to look at.
Brittany, you should have blueprints on there. Do you have?
I have it on the website. I just didn't want to add too many here.
Put it on separate. Okay, it's on there. Okay.
Yes, blueprints for healthy youth development registry of experimental improvement programs. That one. Really long title.
I actually have no idea. I just say blueprints. So yes, that one.
Blueprints. Yeah, that one's listed. We were able to get quite a few from the prevention team, which was helpful. Thank you. Okay. So another big component of your application is submitting an action plan. So it needs to be for 12 months or as close to 12 months as we can get. You can use the template that we have in the Word doc, or if you prefer your own template, that is fine. Just make sure you include all the components which are listed here. Your measurable goals, your activities, how it addresses risk and protective factors, and your plans for evaluating. So this is what's in the application. It's a little different than last year. We try to make it a little more comprehensive. So you want to have what's the risk factor or protective factor you're addressing, what your goal is, the activities to address that goal, your strategies here, who's responsible, by when, what are the, short-term process, short-term and long-term outcomes, goals that you have associated with it. And then down here, you can write your general plans for evaluating the effectiveness of each of these activities. So that is, I know last year people kind of did a couple of these. So they had one that was specific to this goal, and then, a separate one for a different goal. But if you have one overarching goal and multiple activities for that goal, that works too. So it's flexible, but these are the components you want to include. And this is the CADCA 7 strategies. This is where you would put, okay, here's activity and here's what the strategy aligns with in the CADCA 7 options that you have. So I kept this, I provided this last year, the evaluation plan. As you can see, it is a lot simpler this time. So really for evaluation plan, you just need to kind of have some idea written here of how you'll measure progress. But your evaluation plan will be helping to see if the process, short-term and long-term objectives are met. So that's already included in the action plan. And then you can consider, there's more examples you can look through if you want to see other evaluation plans. Most of the programs that people chose had a strong evaluation component already included. So you could, just mention briefly that you're going to follow the evaluation plan already set up with the program. But this just gives you an idea of the types of things you want to include as you're evaluating, if you need to do your own evaluation, if you don't have the support from the evidence-based program, or if it's already built in. So it's essentially, though, just evaluating that your activity, actually does what you think it'll do, most likely. Okay. On to budgets. So we already talked about how the awards are between $50,000 to $100,000. I went ahead and copied, this is what we had last year as well, but we have specific budget requirements that you want to keep in mind as you're putting together your budget. So no more than 2 to 3% can be used for trainings and travel costs. So think about, you can consider how that might look and how you want to use those funds. No more than 10% can be used for administrative costs, and you want to build that in to your budget. Up to 5% can be used for equipment, but anything over $5,000 must be approved beforehand. And if you're putting that cost within your application, that's something we would review as part of approving your application anyways. So that'll help take care of any of those questions. Up to 10% of funding can be used for evaluation. There's no limit to the amount of salary support that you can request. Make sure to include the position details for whatever positions you plan to fund with this money. And then funds cannot be used for construction. So appropriate justification is required for anything that you're requesting. That's part of what's in the application anyways. And you can use what we provide or something similar. So this is what we provide. We've got the category of funding listed, and then this space next to it is your justification. So make sure you're clear about how you're getting to the total cost and why the funding, or how the funding will be used, how it fits into your plan, and then the total funding amount to the side. It's pretty straightforward. And this is all that's required. You don't need to write a separate budget justification this time. A little simpler. Okay, any questions about the application in general before we go to the next part?
No, I love it.
It's a Word doc this year, not a PDF. So it should be easier. I'm going to actually pull it up real fast. This is it. Yeah, so this is the Word doc. Wait, can you guys see it still?
Yes, we can.
Oh, good, good. So this is the front cover page you'd fill out. And then this goes through what's required. So you could literally just, section 2 community description, that's a required section. You can just make some space in here and write your answer right there, right? Or if you feel more comfortable, you can put your application in a separate Word doc with each of the headers that are required, and that's fine too. But it should be easier to use for us. Just make sure that you answer each of these sections. Okay. Go back to this. And then I guess I should say, and then just email me your complete application. by the 30th. All right, so just really quickly, we had a great last year. These were our awardees from last year. We had 4, the Spanish Fork City, Provo City School District Communities That Care, Pleasant Grove Cares Coalition, and American Fork Police Department Communities That Care Coalition. So you can see how they all met the eligibility criteria, some of them in multiple ways, which was kind of cool. And they did a variety of activities. This is a summary of all the different things that they chose to do and were approved to be done last year, to give an idea of what you can do with this funds. So quite a bit was done in the schools and then in the communities. So we'll just talk about each of these, but a few of the grantees did some sort of vape prevention campaign or media campaign. I shouldn't say just vape prevention, but some kind of media campaign. One of them was a vape prevention campaign with signs. Someone else wanted to do commercials. A group wanted to have a website that they were able to get contract with a professional group to put together. So that was a great use of the funds. A few of the applicants chose to do vape sensors for their junior high school bathrooms and to get signs in place for that, which was neat to see that actually come together. One group decided to do Project Towards No Drug Abuse. And so they were working with their school resource officers to make sure that as kids were caught vaping with the sensors, there's something to, or just caught vaping in general or doing other behaviors with drugs, there's a training that they could be referred to, which is great. You know, we're not just going to expel them, but we're going to try to get them some kind of help once they're found using vaping or other drugs. One group wanted to work on adult gatekeeper training, so we worked with them to put together a training, but they did their own research as well and were able to deliver this to their school staff and other school personnel so that they know what to look for when they're in the classroom, behaviors or signs of kids using vaping products or other products, other drugs. And then one group did second steps curriculum. So it was something that the school district was really interested in getting anyways. And so that aligned really well. And they were able to get the second steps curriculum in place. Another one had the Why Try program paid for and implemented in classrooms. We had some do the positive action program, which is the social emotional learning in the classroom. And we're thinking about trying to get it in school clubs as well. So classroom setting or maybe school clubs, after school clubs. One grantee got the Love and Logic program implemented in their schools. A few of the grantees wanted to kind of build a youth advocacy group in their communities. And so we have an outrage youth advocacy group that's countywide, and we were able to create a club chapter agreement with 2 of them, which was neat to see that capacity growing. Yeah.
Sorry,
Oh.
nope, that was me yelling at my children.
Oh, you're good. Okay, keep going. Just kidding. Just kidding. And then the last idea that someone worked with a few grantees did Guiding Good Choices, which is a parenting class in the community. We're able to offer dinner and childcare and able to offer that class in the community. So those are just some of the programs that were approved and funded this last year. It was great. I think everyone did a fantastic job with limited time and COVID in the mix. So that was exciting. So I just wanted to share those as ideas, especially if people are watching and haven't done this grant before, to give you an idea of what you could implement. So that's all I have. If you have any other questions, you're welcome to reach out to me, call, email, and then you can also go to our webpage here, which has more details. In fact, I'll open that. So this is what the webpage looks like. It kind of goes over background of the application. This is the request for proposal document you can look through. I'll put the link for this meeting here. So, sorry, the recording and PowerPoint slides. So you're welcome to rewatch or review the PowerPoint slides if you'd like. A link to the grant application, and there's all the evidence-based websites that you can go to find web evidence-based or promising practice programs and review those. So Shirley, Tamara, how are you guys feeling? Anything you'd like to go over specifically? Was this helpful to you, or
Yeah, this was very helpful. You did a great job.
thank you.
And, and yeah, I think everything's very clear. I guess if I did have a question, but I think you pretty much answered it, and I guess I'll just verify. So we can use our own format if we have a format that works well.
Yes, as long as it's clear to me, I would just encourage you to include the headers for each of these. So the application cover page, I would just use what's here. But then just have these as each as a header, and you can put the required information underneath each header. And that would be great.
Okay. Perfect.
Mhm.
Yeah, you did great. Thank you so much.
Well, thank you. If you have other questions, feel free to reach out. I'll go ahead and stop the recording now. Let's see if I can find the screen.